I'd like to welcome you to this FIP event. How can digital health support national pharmaceutical care delivery? My name's John Jackson. I'm the president of the Western Pacific Pharmaceutical Forum, and this is an event specifically for the region of the Western Pacific. Next. It's my great pleasure to not only welcome you all, but also to welcome my co-host, Chingsun Walter, from the FIP YPG group, and thank him for his contribution and assistance with this process this evening. Next. What we'll be doing in a minute is to run through the program for the evening, but before I do that, I'd like to make a few housekeeping announcements. We are, as you've heard, recording this webinar, and it will be available to be live streamed via YouTube, and will be available on the FIP website, events.fip.org. If you have any questions, please put them in the chat box. We will monitor that, and if time permits, ask our speakers to respond accordingly. And you are always welcome to provide feedback to FIP on these webinars at webinars@fip.org. So next we'll move on to our next comment, which is to recognise that events like this can only be delivered to you with support from organisations, as is this case from Pfizer, in our Partner for Better Health program, supporting this and other programs such as regional webinars, and this is with unrestricted funds, and I'd like to express our appreciation to Pfizer for what they're supporting today. Next. I'd like to also recognise and acknowledge the FIP Global Pharmaceutical Observatory team. You can see their names on the screen there, and the support that's been provided by a number of people in FIP to the development of this program. The team in FIP and in the Pharmaceutical Observatory do a wonderful amount of work behind the scenes to ensure these kinds of events are delivered to you as we are doing this evening. Next. So, before I introduce our very first speaker, I want to say to you that there are three topics that we'll be addressing in various formats this evening. The first, as you can see here, is a presentation by Christopher John, who is the FIP lead for data and intelligence, and is a pharmacist in the UK. The other two and main sessions of this evening will be a discussion on digital health and its support for medication adherence. And we will have three people who will be panel members in that section, and I'll introduce them when we get to this point. And then after that, there will be some presentations on digital health and substandard and falsified medicines, and we'll hear a number of presentations on that. So, as I said, as we go through these events, if you've got any questions, please put them in the chat. So, Christopher, can I hand over to you to tell us a little bit about the FIP Global Pharmaceutical Observatory? Over to you, Christopher.
Thank you, John, and hello, everyone. If we move on to the next slide, you'll see that the Global Pharmaceutical Observatory, the FIP GPO, is the engine room of global pharmaceutical data collection. The FIP GPO will measure and monitor progress towards the development goals, and indeed digital health is one of our development goals. I believe it's development goal number 20. The FIP Global Pharmaceutical Observatory's mission centers around data, intelligence, advocacy and reporting. We know the importance of data. We know that it's become very important during the COVID-19 pandemic. And we know that the importance of data and for data to provide us with evidence which demonstrates impact. So our first task is always to collect valid global data on workforce, education, practice, and pharmaceutical science. We must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence, and all this must be communicated innovatively to promote our member organisations' impact on health. The communication will often be via the FIP Atlas, which is our visualization platform for displaying our data and intelligence across the globe. And finally, we will provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science, policies, practices, and services. On the next slide, you'll see some of our work streams that are currently underway with the Global Pharmaceutical Observatory. Indeed, today's event is part of our multinational needs assessment program. We will continue to take a tried and tested needs-based approach to addressing data and development goal challenges through the development of programs such as MNAP, which is the Multinational Needs Assessment Program. The FIP GPO Atlas is a platform for showcasing our members' needs and priorities, and that's supported by data from the GPO, and it allows FIP to identify opportunities for developing pharmacy for and through our members. The FIP GPO database is the repository for our data, whether it's pharmacy, pharmaceutical science, or workforce. It contains data that informs indicators which will be used to track progress against the FIP development goals. The FIP development goals provide the framework for needs assessments and prioritization for member organizations to undertake relevant to their national situation. In turn, the priorities can provide each organization with the foundations for mapping the progress and transformations for their workforce, practice, and pharmaceutical science. Indicators will be a way to measure and monitor progress, as I've said, and transformations across workforce, practice, and science against the development goals via the data we collect. So finally, we have a very important group of people called the Data and Intelligence Commission, who provide us with a lot of advocacy, advice, and strategic advice on the direction of the GPO project. As well, we also have a large number of events that are delivered throughout the year around data and intelligence and evidence and impact. So just finally on the next slide, you can see a link to our GPO microsite. Please do click on the link when you have a chance, or scan the QR code, and you can have a good look around at all the work that's going on. So I'll hand back to John, and thank you so much. Enjoy the rest of the event.
Thank you. Thank you very much, Christopher. Yeah, great work there. Look, I'm actually going to hand over to Walter at this stage to co-host this part of it. Thank you, Walter.
Thank you, John. I'd like to brief the program now. I will show you that we have two topics. The first one is substandard and the falsified medicine, along with the lack of adherence of the medication regimen, pose a threat to the public health worldwide. It is possible to deliver pharmaceutical care services that address the challenge using the digital health techniques and approaches globally. The digital health faces many challenges and concerns, despite its potential to impact pharmaceutical care. So, FIP and the GPO has launched this new needs assessment program, also called MNAP, entitled with "How can digital health support national pharmaceutical care delivery? A regional and global assessment of priorities and challenges." This event includes a series of 6 regions, and will culminating in a private, global, and roundtable summary report. And next slide, please. As we mentioned before, we are focusing on 2 topics. First one is the digital health to support patients' adherence. The second theme is the digital health to fight substandard and falsified medicines. And we'll to discuss its ongoing initiatives, drivers, and challenges, and the pharmaceutical leadership bodies and the national phases, the integrating digital health into the pharmaceutical patient care. So next slide, please. And this is a very nice outline. We have started the introduction of the moderator and about the program as well. So we'll move on the the next different things. We'll divide the event to two topics. The first one is the digital health about the adherence of medication, and second will be the falsified and the substandard drugs, and lasting a total of 13 minutes for each. And we had audience engaged activities between two topics. Thank you. So let's have John to take over the first thing first. Thank you.
Thanks, Walter. And yes, if I can have the next slide, please. It's my great pleasure to moderate a panel session here looking at, as Walter said, digital health to support medication adherence. And I've got three panelists that are joining you tonight. One is Jared McMaugh from the Pharmaceutical Society of Australia. He's the state manager for Victoria and the lead for digital health in the Pharmaceutical Society of Australia. A lot of experience there. And thank you, Jared, for joining us. The next is Eric Kinlat Lee, who is at the Kaohsiung Veterans General Hospital in Taiwan, a member of the Taiwan Society of Health System Pharmacists. And again, thank you, Eric. Looking forward to your contribution. And the third is Leonie Ocampo from the Philippine Pharmacists Association, a past president of PPHA and operator of the Asia Pacific Institute of Medication Management. So three panelists, and I'm going to ask each of them to address a couple of very specific questions. So I hope my panelists are all ready. My first question is to, well, and I'll start with Jared. I'll take them in order. Jared, does your country or organisation, and I'm happy for you to address it from PSA's perspective or Australia, provide any digital applications or interventions that facilitate medication adherence as part of the pharmaceutical care service? And if so, can you provide some examples? Jared?
Yeah, so there's a number of services that are available in Australia, both personal apps that people can use, but also digital health systems that have been implemented by the government. PSA certainly contributes to the development of these through consultation processes, but it is definitely an Australian government process. So probably the most impactful one is the My Health Record, which is a shared health record, so that health professionals can access a unified piece of information about individuals. The other one that's been essential throughout COVID has been the introduction of e-prescriptions. Now, there are a number of other aspects, but those two are probably the most important from the perspective of compliance, mainly because they assist health professionals in getting accurate information. Either the health record is up to date and accurate if people are using the My Health Record correctly, or in the case of e-prescriptions, you get information that is not subject to transcription errors, which means that a big part of the errors that can occur with medicines will be addressed through that system. So what that means is that people are able to access their medications from doctor to pharmacist in a manner that reduces errors and allows those health professionals to focus on conversations that are contributing to improved compliance. There are some other apps such as the Active Script List that helps you control where your electronic prescriptions are as well, and that helps with compliance as well. But I think those two of the ones that we have are probably the most impactful for compliance's perspective.
Jared, I know we have somebody from the Australian Digital Health Agency speaking to us in a minute about some of these matters, but can I ask you very quickly to broaden your response and what apps or SMS aspects are there available to pharmacists in terms of digital health?
Yeah, so at the moment, as far as patient-facing apps are concerned, the primary one that people use is an app called MedAdvisor that people use to look at their medicines history. You can see what prescriptions they manually log into that app. It can also handle e-prescriptions as well, but doesn't collate them quite the same as that software I was talking about before called the Active Script List. That same piece of software is quite often rebranded for many of the different pharmacy groups in Australia. So a person could have a single app and it actually works in all the different pharmacies. And that allows the person to see their prescription history, see what prescriptions they've got left and understand what they're for. It does provide a certain level of information and also contact back to the pharmacy as well. So it is very much about managing their e-prescriptions, but it does allow you to manually log your paper prescriptions as well. So as long as you get that entered correctly, then you'll have a pretty good resource there for keeping track of your scripts and when you last had them filled.
Thanks, Jared. I'm now going to ask Eric to respond to the same question from the Taiwan perspective. So, Eric, here we're talking about what digital health applications or interventions there are in Taiwan that facilitate medication adherence.
Yes, thank you, John. And I can talk about the Taiwan experience of the medication reminder application. In Taiwan, patients have been provided with medication reminder application by some hospitals. Forms of the apps may vary, but they are often extremely easy to use. A patient should be able to access their exclusive QR code that given by the hospital. And the QR code serves as an identification code which takes patient to their specific information pages. Take the app in our hospital, Kaohsiung Western General Hospital, for example. In the app, patients can set alarms according to their list for reminders of medication taking. At the time of reminder, pop-up information regarding drug information is presented to the patient. And furthermore, patient may access functions like medication list, blood pressure, and blood sugar tracking system, all within the application at the comfort of their home. Diagrams of blood pressure and blood sugar would be provided for patients' visually inspection. On the other hand, physicians may also get hold of patients' records and medical history in the app to ensure patient safety. Our app is further connected to drug information website, where its appearance, package insert, education material for patients can be found. In addition, if patients have any questions about their medications, they can easily ask pharmacists online in the form of an interactive, patient-specific, safe online platform. That is, I'm talking about our reminder application.
Eric, fantastic. So we're starting to flesh out some options here. We've heard stories about access to electronic patient data. We've heard stories about prescriptions, electronic prescriptions, about compliance aids and some drug information. So Leonie, looking to the situation in the Philippines, would you like to tell us anything that that is happening in either the country as a whole or through the PPHA to see digital health applications and supporting medication adherence?
Thank you so much, John. Now, actually, hearing what has been said by our colleagues here, from Australia and Taiwan, it's different in the Philippines because digitization of pharmacy here is independently done by the private sector. There is none yet at the national level, which is initiated by the government, none. So although there is already the digital health services being happening now, where we are serving electronic prescriptions, but these are all initiatives of the private sector. And what is nice is there are some chain groups who are in a cluster who do have their system that allows interoperability, where one could see the data of the patient in the other chain. But these are all owned by the same set of owners. So the nice thing, while this is the picture that we find in the Philippines, the system that are being used now by many of our store operators are like the one where I came from, the MedExpress. It was developed by us from the process that we mapped out. So it was customized. What exactly do we want in the operation by a very good programmer that would allow reminder to patients of their refill, and then measuring how the adherence is and everything. So all data we were able to gather so that we would be guided as to what would be the next thing that should be done to enhance the system. The nice thing, John, is there is a plan of the government to go into this, because that's why I was late in coming in. I was just from a meeting of a legislator who requested me to work with him on how all of this thing will happen, because the government is ready to provide the resource on how all of this thing should be done here.
Thank you, Leonie. Fantastic to hear that last piece of news that you reported there. I'm now going to go back through the group and ask them, we've heard what they're doing, but I want to ask them, and I'll start back with you, Jared. What barriers are there to integrate and mobilise digital health interventions? Would you like to speak to that from the Pharmaceutical Society of Australia perspective?
Yeah, so one of them is regulation. Now, regulation is really needed to provide a very stable environment in which digital health can exist, but that does clearly slow things down. I don't think that's a negative thing in this instance, but you do need to be aware that if the regulations don't allow for innovation, then perhaps we end up with options that are not available to Australia that are available overseas. Realistically, one of the biggest barriers at the moment, as far as digital health delivery from a pharmacist's perspective, is interoperability of certain software. So we have methods of doing secure messaging between different health practitioners that would ensure that that messaging is encrypted, so we can discuss people's compliance, for instance, if that's necessary. But the current platforms that allow for that discussion are single channel, which means if I'm registered to one product and you're registered to another, then I can't talk directly to you via that method. A second part is, I mentioned earlier, there's this piece of software called the Active Script List. That'll allow people to use like a digital wallet to control all their electronic prescriptions. At the moment, that's not yet available for patients to download themselves and actually see all their prescriptions in one place. And I would certainly say that the Active Script List has not been taken up in Australia as much as most of the stakeholders have expected to be. And perhaps Andrew will talk about this when he gets to his section. But I believe that is part of the reason, is that one of the main barriers is that people are the drivers of technology and demand. And at the moment, when they can't drive that particular piece of technology, it hasn't had the uptake that you would expect. So that one's a real barrier. The first one is more of a theoretical one, but it's an important and real one too.
Thank you, Jared. I'm hearing stories of some large government-run programs and the need for regulation and interoperability. I do also ask our panelists to think about some of the barriers that might exist in the in community pharmacy, the levels of application that might exist, and whether the community pharmacy or the hospital pharmacy system is digitalized adequately. So, Eric, tell us about the Taiwan experience. What are the barriers to integration and mobilization in Taiwan?
Yes. Fortunately, in Taiwan, the information technology and big data technique is quite mature in Taiwan. Our Central Health Insurance Administration of the Ministry of Health and Welfare has implemented an electronic health passport. Everyone can use his or her mobile phone using Healthcare Express app to get their health information, such as all the medical history from all the hospitals they have visited. However, in Taiwan, the age group is a problem. Many elderly or other patients are not familiar with electronic devices and are afflicted with chronic disease requiring long-term pharmacotherapy control. And currently, we naturally rely on pharmacists to examine whether the patient is having a proper medication regimen. However, as the number of patients increases, it's likely mistakes surrounding the dispensing process would go up. And therefore, it is our impression that having the right medication taken at the right time and is crucial and needs urgently action and increase the medication adherence by educating or teaching the elderly patients to use the new medication reminder app or any kind of application.
Fantastic, Eric. Yes, it's. I do recognise the advanced level of the system in Taiwan. That is fantastic. Leonie, you've already mentioned one of the difficulties was the systems were developing in individual companies, but there's this prospect for integration. What do you see as the main challenges, particularly if I'm a pharmacist in a community pharmacy? What are my main challenges?
Okay. John, I would like to thank you. I would like to categorize into two the challenges and the barriers that we are encountering here. Number one is on regulation, because there is no clear guidance that is coming from our regulatory agencies as to how all of this should work, how all of this should operate. So anybody can just go into it. That sometimes you would find some pharmaceutical products being sold by non-licensed facilities who's coming into a platform which is not regulated by our Food and Drug Administration. The second is on the pharmacy itself. So the community pharmacies ourselves, which I would also categorize into two. For chain store operators, because we have big chain store operators in the country, and you know that because you've observed it here. It's good because they have all the resources, they have the systems to do it. They have very good system being used in how the monitoring of patients would be, how the refill of their medications would happen. However, the big challenge is on the independent pharmacy players, because there is still the unreadiness of our community pharmacy operators, which are operating independently, not ready as to how things should happen. And second, there is no system that they don't still have the system that could be used as their enabler to allow the operation run. So these are the things that we are trying to take a look at, and which I also have to share to our current leadership in the organization, that we have to give attention to the independent players, because we have to support them, be ready, especially when the government would want a full implementation of this, as the universal healthcare would come in to be implemented. So we don't want our independent community pharmacy not to operate in a profitable manner. So we have to help them.
Thank you, Leonie. And look, I'm going to come to one final question that I'm going to ask each of our panelists. And just watching time, I'd ask them to very succinctly respond to this question. The question is, what are the enablers? To think forward, what will enable us to move forward with digital health? And in doing so, I recognise what you've told me about government systems and the like, but there's a private sector here and there's a public that is becoming much more digital savvy. So what is it that's going to come together here that's going to enable us to provide digital support for medication adherence in the future? Jared, what's your thoughts?
So I think one of the biggest enablers in Australia's setting is the unified vision. So by having that regulation that I referred to as a barrier earlier, it actually provides a clear path forward. There is a really good example set overseas as well that we can draw on and look at what can be done. But I think the regulations here really are a good enabler. But the other one is really tapping into the enthusiasm for patients. So one of the points that was raised earlier by Eric is that we have elderly patients, for instance. Now, throughout the world of COVID, we know that people who've taken up technology quite effectively and they can utilize that really effectively. And for that reason, we have now telehealth services in pharmacies that haven't previously been there before, or at least not viable before. And so I think one of the things that is a huge enabler is not overlooking the patient or the community's acceptance of digital technology when it's providing, especially when it provides them with access to things that they either couldn't get or is much, much easier for them afterwards. And that is probably the biggest enabler as a pull, and the regulation from government is a really good enabler as a push for getting movement in digital enablement and technology adoption.
Thank you, Jared. And just before I ask Eric to respond to the same question, I just want to bring to people's attention the chat and ask you to note that Farah from FIP has put reference in there to an FIP GPO document around digital health. So you might want to look at that while the program's in train. Eric,
yes.
put your forward-looking. Let's look to the forward. What do you think of the enablers?
Yeah, as I was talk about in the barriers, in Taiwan, we have a health insurance administration. They have an app used by all the publics in Taiwan. And it provides a health insurance subjects to conveniently inquire about the personal health information, and can also provide physicians reference when seeking medical treatment to help physician quickly get the personal health condition and just through the mobile phone or finalization under the patient's name, online health insurance card, insertion, and it's very convenient for the patients. And however, now it is only for physician, but not for the other health practitioners such as pharmacists. So the pharmacists are not allowed to use the patient information or from the system. And I hope one day if this information can open to the pharmacist use, it can benefit our pharmaceutical care practice. And also if the drug information can be downloaded to our medication reminder application, just like QR code, and it can facilitate and enhance the patient drug information and remind the patient to take the drug at the right time and take the drug at the available pills at the and I think it's enhanced their adherence to take the medication.
Thanks, Eric. And Leonie, coming to you for your final comments, thinking to the future. It's great to hear what's happening with your decision now with the government. What do you think of the enablers?
Thank you, John. I've actually enumerated 5 that I suppose would be the very important enablers to make this all happen. Number 1 is the management and leadership of both the private and the public sector. If you're in the private sector, how the corporate organization should operate should have the proper support provided with the resources that would be needed to make all of this happen. Same with the public sector. Second, I would say we need to have the right legislation that would serve as the right legal framework for everything to happen efficiently. And then the third is a clear and efficient regulation that should happen. And fourth, of course, very important, are competent people who drive all of this to efficiently and effectively work. And the fifth is the right system to put everything in place and be able to really guide things to happen. Now, as I mentioned, I'd like to share, I was late in logging in because I was from a meeting with a legislator, a senator of our country, who is asking me if I could help them draft the digital health bill, which he plans to sponsor to become a law. So in the pharmacy sector, I'll take care of it. I said, yes, I will. We will help through the association. And this is going to be a teamwork with the medical practitioners and everyone else who would be involved in here. So this is something that we look forward to, John. And definitely, of course, we need help from FIP and all of you, WPPF, for anything that later on we will need, just as when we were lobbying for a change of our pharmacy law and the inclusion of immunization for our function. So we really thank always the global leadership, especially you, John, who's always in the Philippines. Thank you very much.
Leonie, thank you for really summarizing very well with your 5 points this session, and congratulations to you for what you're achieving with that senator. I'm sure it will be in good hands. And I think you actually made a point there at the end that's probably worth reiterating. We don't work in isolation. We work for our patients, but with other members of the healthcare system, and including the doctors. And if we're going to have good digital systems, we need to have that communication and work with those other healthcare practitioners to make it work. So, look, I want to thank Jared and Eric and Leonie. They've all thought well and hard about this and given you some wonderful things to think about. And as Leonie said, You can learn from each other, and you can contact the panelists later if need be, and FIP's resources are available to you to help you develop your digital system. So thank you for the panelists. I'll be coming back to a number of them later in the session, but right now I want to introduce one particular speaker, Andrew Matthews. Andrew is the engagement lead for digital delivery section in the Australian Government's Department of Health and Aged Care Digital Health Agency. And Andrew's been very heavily involved, and particularly through COVID, with something that Jared mentioned earlier, which is the introduction of an electronic prescription system in Australia. So, Andrew, it's over to you. I'd like you to give your presentation at this stage. Thank you.
Thanks very much, John, and good evening, everybody, and especially to those in the Western Pacific, but also to everybody around the world who, through the chat, I can see are dialing in and enjoying the presentation as much as I am. So, look, thanks very much to FIP for the invitation, especially to Farah, Farah Arad, who has actually invited us to be part of this meeting, and so I'm very pleased to be involved. Look, this work, as John suggested, was some work that was undertaken as a national project under the auspices of my previous employment when I was at the Australian Digital Health Agency, and now I'm with the Australian Government Department of Health, when both organisations work very closely together. So my focus is very much on how those electronic prescriptions helped impact medicine adherence, especially during the COVID-19 pandemic. Now, as far as medicine's adherence goes, there's nobody on this particular audience that I need to emphasise how complex the challenges are around medication adherence. And we know through a World Health Organization document that up to 50% of patients living with chronic disease do not adhere to treatment recommendation. There's many researchers around the world who investigated ways to overcome this. And certainly our own FIP has done a lot of work in this space, and I refer you to the reference in the slide deck at the below there from a 2018 document on the same thing. But we do know that medicine's adherence is either intentional, where a patient makes a deliberate and conscious decision not to take their medicines, or unintentional. And certainly one of the things that came up through the COVID-19 pandemic and the associated lockdowns and quarantine isolation periods was that many patients, just because they could not leave their home, were struggling to be able to access their medicines. Now, this is something in rural communities, especially in Australia and of course around the world, has been an issue for a long time. And one of the things that Jared touched on beforehand about telehealth was that whilst there's been advances in telehealth for a number of years, and especially in remote locations in Australia, getting the medicine to the patient, and especially even just getting the prescription to the patient, was always an issue. So beyond the COVID-19 issues and the importance of establishing new ways of delivering and accessing medicines, there will be ongoing benefits associated, especially in telehealth and rural locations. But there's no doubt that the introduction of electronic prescriptions to Australia was an important digital health initiative to support medicine adherence during this COVID-19. And I suppose I need to point out, when we were talking about some of the barriers and challenges, Australian clinical peak bodies and software vendors and the government came together, and electronic prescriptions have been being worked on for many years, to be honest, and there was various steps and challenges along the way, but a lot of the barriers were overcome when people realised that this was just something that needed to be done through the COVID-19 pandemic. If I can have the next slide, please. So if I can just introduce what an electronic prescription is, it is a purely digital alternative to paper prescriptions. And in Australia, and this is probably not unique, a paper prescription signed by a prescriber has been the only legal form by which medicines are authorised to be supplied in Australia. And so the work that we did was to actually introduce electronic prescriptions that meet national and state and territory legislation. Now, in Australia, the subsidy scheme for medicine supply is through the Pharmaceutical Benefits Scheme, and that's coordinated by the Commonwealth Government. So there was changes that need to be made at Commonwealth regulations to change the payment and recognise the form of the prescription at a national level. But the true sort of requirements for a prescriber and a dispenser are set in state and territory regulations in Australia. So it meant not only was there regulatory changes needed to be made at a Commonwealth level, but also at the state and territory level. But we did want to make sure that electronic prescriptions are not mandatory. And for those patients who prefer a paper prescription, you can still get a paper prescription and not just an electronic prescription. Next slide, please. So, as I mentioned, a lot of this work was put in place previously, and now that I'm with the Department of Health, I've been looking through for some of the old filing systems showing that there's been work in this space for over 10 years. However, in 2018, myself and my team were tasked by the government to develop the technical framework documents. And by that, I mean what's called solution architecture, what was called a conformance assessment scheme, and a conformance profile. So three key technical documents that would actually guide vendors of clinical information systems, i.e. dispensing systems and prescribing systems, of our expectations about what they needed to do to introduce electronic prescribing and electronic prescriptions. So that was co-designed over a 12-month period, and the documents were written up and then reviewed by this what was called a technical working group, and ultimately was agreed, endorsed and published in October 2019, which was very handy because the government recognised this, and when the pandemic hit, Australian government announced their plan to fast track electronic prescriptions, knowing that a lot of the technical framework was already in place. So they set us a fairly hefty goal to actually have electronic prescriptions in place by 8 weeks. Now, at that time, we had a 6 to 12 month implementation plan. So they said that it had to be delivered within 8 weeks. So clearly my workload went up from about a normal 40-hour week to about a 65-hour week, as did many others across clinical peak bodies and software vendors, and across the Digital Health Agency and the Australian Department of Health. But we did actually work with software vendors and clinical peak bodies to make some minor changes that would make it easier for software companies to develop the requirements, develop their software to accommodate our requirements. So we did have to take a small number of mandatory requirements out of the original conformance profile to get this quickly pushed into place. And I was very pleased to say that exactly 8 weeks after the national plan was announced, our first electronic prescription was successfully transmitted. And I'm very pleased to say that there's now over 75 million electronic prescriptions have since been issued since that date. Now, that's not in Australia, there's about 350 million prescriptions every year. So there's still only about 10% or so of prescriptions per year at this stage being electronic, but nevertheless, it's increasing all the time. Next slide, please. Now, just to put that in place, there's a lot of communication plans that were put in place and a lot of communications and materials. But what we were trying to promote, that patients can get their electronic prescription through their phone. Eric already mentioned tonight about the importance of QR codes, and Jared mentioned the active script list as well. So it can come straight to you and you control it through your phone, or it can go to what's called an active script list. And the important thing under isolation rules was that if you had to isolate at home, and your pharmacy did actually do home delivery, then you could forward along the electronic prescription or the QR code itself, because the electronic prescription is actually held securely in what's called a prescription exchange service or a prescription delivery service. But you could forward the QR code onto your pharmacy, and if that pharmacy home delivered, could be delivered to your door completely contactless, which is obviously important in COVID-19. Next slide, please. So just a brief overview that if you are receiving your electronic prescription or your QR code, it's really just an opportunity for as I said, the electronic prescription and the full legal details are actually held securely in an encrypted prescription exchange service. So when a doctor sends the prescription to the patient, they're actually sending a message via SMS or by email, or they could actually print out this QR code, but that is sent to the patient to their phone. Once the patient opens up that SMS, it exposes a QR code that can be taken or forwarded to their local pharmacy. So this is just an example of what that looks like, and there's a lot more involved with this. Next slide, please. And then, as Jared has already mentioned, this active script list is a more streamlined way of actually managing exactly what the name says, your active scripts. So those scripts that haven't been already dispensed, if you sign up and actually agree for your pharmacy to be able to view all of your active scripts available to be dispensed, then you can actually just go into any pharmacy who you've actually registered for with your ASL and to be able to get that script dispensed straight away. So it does actually, if somebody's on a single medicine, then getting a single QR code through an SMS is a pretty easy way to manage your script. But if you're on multiple medicines, and we've already talked about some of the issues of chronic medicines management and the impacts on adherence, and this token management solution where the active scripts are collated at the through the pharmacist can view and dispense direct from that is a very handy alternative and a more streamlined way to go. So, John, that's really the presentation for this evening. I know I only had 5 to 7 minutes. I hope I've kept the time, and I'm very happy to respond to questions either through this channel or through other channels in future.
Really fantastic presentation there, Andrew. It's great work that you've been involved with, and as an operator of a pharmacy, I really do appreciate what's been done through this process to enable pharmacists to access electronic prescriptions. So I'm now going to hand over to Walter to take you all through an engagement activity. Walter, it's over to you.
We're happy to see you again. We'd like to invite you all attendants to our engagement activity. On your screen, you will see a poll, and we would like to invite you to select top 3 most challenges to implementing digital health in the pharmaceutical care service. So if you'd like to share more detail with us, please use your chat box to tell us further more detail and elaborating. And I'd like to share some definition of our choice. The first one is a lack of the regulatory and the model policy and the strategies. As we know, they have many regulatory barriers for our digital health implementing. And the second one is the economical and finance concerns. Sometimes the cost will be too high or too expensive to development the digital health. The third one is the patient confidentiality and risk of the safety. Sometimes there's a security problems for our development. The fourth is the variable technology literacy and accessibility in the community. Sometimes it's a patient's community don't know how to use or how to access the technology. In contrast to the fifth, the lack of professional learning and the training for the pharmacists in the digital health. It is because in contrast to the patient, sometimes it's not our professional or pharmacist is not know enough knowledge for this technology. And the sixth one is the lack of the evaluation and mechanism monitoring for the digital service. Sometimes we don't know how to do good monitoring tools and use them to evaluate our digital health and its effects. It is a crucial problem to our digital health problem as well. The last one is a lack of the interoperability of a system. Sometimes we have a different operative system, so we have to standardize the material and the tools to add a uniform or unite comfortable or standard system. So that's our polls and our selection. So please to take ours to take your top 3 selection, and we'll know what is our activities and goals and common sense. Thank you.
So Walter, will give it 10 more seconds and then I'll end the poll and launch the results.
Okay. So we'll wait for our result. Thank you. And if you want to share more details, please use our chat box. Thank you. As we saw that the first place is a lack of regulatory models, policy, and strategies. I think it is some we had mentioned before in the forum, and the second place is a variable technology literacy and accessibility in the concern. And the more interesting one, we have double third place. The first one is economical finance concern, and second one is patient confidentiality, risk, and safety. I think this is about our barriers now. And how's the opinion of the John? And John does have any comment? Thank you.
That's a very, very interesting set of results there. We've got a lot more people on the line than have voted, but for those who have voted and engaged, thank you. It does give us some guidance, and hopefully it's of use to you as well in seeing what the issues are. Eric, did you want to, Walter, did you want to say anything else at this stage about this? If not, we'll move to the next slide. And here we're moving into the next part of our program, which is to look at how digital health can be applied to the issue of substandard and falsified medicines. And we have a number of speakers, two of whom you've already heard this evening, and asking them to speak very specifically around this particular topic. So if I could actually have the next slide. I'd like to reintroduce you to Jared McMaugh from the Pharmaceutical Society of Australia, speaking on this topic. And we're looking to hear what it is that Jared and the Pharmaceutical Society of Australia has got to say about the issue of substandard and falsified medicines and how potentially digital health may help. Jared, it's over to you, please.
Thanks, John. So one of the things, if we move to the next slide, I want to highlight the fact that Australia is in a fairly privileged position, and that is that substandard medicines are really uncommon, and falsified medicines or counterfeits are uncommon, a little bit more experience than we do with substandard medicines, but it's really not a very common issue in Australia, which means that as a priority for public health concern, it's not as high as some of the other issues around communication and sharing of information, and therefore the digital health focus for Australia is not so much in this space. So what I'm going to talk about really is some of the issues that have led to that position, why it is that it's not a major concern for us, and we'll leave for the other speakers to talk about some of the technologies that they are implementing. Australia certainly has technology in place that assists with tracking of medicines to ensure that it is quality medicines, but most of our concerns are around the fact that our regulatory process means that it's not as big of an issue as you would expect. So if we move on to the next slide. So one of the reasons that we have, well, it's probably best to talk about incidents. We've got, it is estimated that less than 1% of all medicines in Australia are affected by either low substandard production or counterfeit. It's probably actually lower than that. Our market in Australia is highly subsidised, so the government actually funds the access to pharmaceutical medicines, which means as a source of profit for people who want to manufacture medicines, there's not really the incentive there. We're also relatively remote. We have very strong regulations around quality of medicines and also importation of medicines, and we have fairly strict border control, which is not perfect. Certainly things do get through, but those things combined have led to a position where Australia is not really very lucrative for companies or individuals who wish to try and target Australia for counterfeit medicines. We do have a very strong market already for those kind of medicines that are quite often falsified or manufactured to substandard methods such as erectile dysfunction and hair loss and things like that. Those medicines are already very inexpensive in Australia, and they're very easy to access via prescription. It's easy to access services that focus on those things directly. So the market is quite strong and very competitive, which means for somebody importing in illegal products, so to speak, it's not really going to do them bring them much profit. So regardless, if you're an Australian citizen and you want to access medicines from overseas, you still need a prescription. So if you purchase these things from overseas where they could be counterfeited or more likely to be counterfeited or substandard, it's very likely to be picked up at the border anyway. And any personal or commercial quantities of medicines are likely to be seized due to all these regulatory processes that are in place. Now, I would contrast that with vaping products. So vaping of nicotine is currently really under pressure at the moment. There is a number of these products entering the Australian market, mainly because they're not regulated as a health product. And there's a loophole that allows these products to enter the country if they claim to not contain nicotine. And yet every product that's ever been tested in Australia that claims to be nicotine-free clearly does contain nicotine. So there are loopholes that allow for this kind of process to explode. But at the moment, it's not really the case for prescription or over-the-counter pharmaceuticals. All of the penalties around any of these breaches covered by the Therapeutics Goods Act 1989. Sorry, I'm starting to stumble a little bit on my tongue. So from a digital perspective, in Australia, all of that funding that focuses on digital health improvement is going towards improving communications and improving access to people's information and ensuring that they've got good quality access to information themselves, rather than getting into the space of counterfeit and substandard production. So if we move on to the next slide. So what are the barriers and challenges? So for Australia, that primary barrier is the perceived lack of risk. Because we do have quite good regulations about the physical importation of these products, there is not as much incentive to put in place digital tracking systems that would assist us in identifying counterfeit or substandard medicines when they do enter the market. In addition to that, there is that low financial benefit to anybody who's trying to take advantage of sales of products that are not as good quality or counterfeit. And given that there is low risk coupled with significant digital health initiatives being rolled out at the moment, that drives the investment of money in the digital space away from counterfeit detection. There is still that high risk. So one of the things I would point out here is substandard production is really unlikely in Australia, because most products in Australia that are sold in the commercial market are not manufactured here. Those that are fairly stringently regulated. So even to the degree of getting a tablet press is actually really difficult to do in Australia due to illicit drugs. So it's actually not easy to set up your own system for manufacturing medicines in Australia. And if you do, there are very stringent good manufacturing process requirements. So people don't set these up and do it on their own, so to speak, at a commercial level. The most common thing that we do see as far as importation is concerned is people who are purchasing in active pharmaceutical ingredients for medicines that are still under patent, very expensive, but not yet subsidized by the government. And so we saw this, for instance, with hepatitis C antivirals. Before they were subsidized by the Australian government, those medicines were being imported from countries that didn't have a patent on them. And there were situations where pharmacists who had compounding pharmacies were being requested to actually recompound these. And so that system didn't have any digital tracking in place, and it certainly would have been helpful in that situation to confirm that the API that pharmacies were being provided with were actually the product that they said they were. That then got closed because the medicines in question, which were very expensive at the time, became subsidized by the government, and suddenly the importation of these active pharmaceutical ingredients by individuals evaporated relatively overnight. If we move on to, I think, my last slide, I think. So what are the drivers? The main perspective here is that driving investment in this particular space from a digital health perspective is only going to be driven by Australia becoming a greater target for counterfeit medicines. So what actually would do that? So keeping in mind that manufacturing in Australia is highly regulated, and that even affects these illicit substances, and wholesaling in Australia is also fairly well regulated, like fairly high regulation. And there's only 3 major commercial product wholesalers, and there's 3 or 4 API importers as well. So you've got not many companies who are working in the space, so it's very easy to regulate them. So that means local counterfeiting is very unlikely. and therefore substandard manufacturing pretty much non-existent on a commercial scale. But what we will see over time is that there will be increasing activities to address counterfeit medicines in other jurisdictions that make them harder for people to sell fake products into. So Australia, if we don't keep up with everybody else in the region, will start to be a target for these things. So we do need to actively watch what other countries are doing and ensure that we are adopting things like QR coding of batches, which currently are used in the hospital setting, I will say. QR coding is used in some hospitals in Australia to help keep track of things like expiry dates and batches for things like recalls. But generally speaking, the technology in this space will only start to receive a larger share of the investment in digital health once it becomes a bigger threat to the Australian market. And that will eventually happen if we don't keep up with other countries, because eventually Australia will be a far more attractive market to try and enter into, because other countries will have overtaken us as far as digital health in this space is concerned. But at the moment, we're quite lucky. And so that's a good thing for us, but we have to keep track of it in the future. I believe that's my last slide.
Thank you, Jared. Yes, very fortunate there. It's now my great pleasure to introduce a new speaker to you tonight, Mark Ryan Langat from the Philippines. Mark is the Executive Secretary and Victoria State Manager for Lead for Development. And I'm asking Mark to address the same three points that Jared just spoke to under the topic of digital health and the fight against substandard and falsified medicine. So Mark, over to you, please.
Yeah, thank you, John. And coming here from the Philippines, we all say mabuhay. So good afternoon and good day to all. Yeah, we're still on the theme on digital health regarding our fight on substandard and falsified medicines. We're having ongoing initiatives. I am happy hearing a while ago our friend Jared speaking in Australia regarding that of having a low priority. But here in the Philippines, of course, we are going into that one on our fight regarding these medicines. Not much also, but there would be cases on this. And we're looking into how the Philippine Pharmacists Association is also having its initiatives like the pharmacy information services that we have set up a few years ago, pre-pandemic, where with this, may I ask for the next slide, please? Where we have, yes, there you go. So this is one of our advocacies in PPHA, Philippine Pharmacists Association. Well, this is more of a general approach, not only on substandard and falsified medicines, but we are encouraging the people, the community to be contacting this group. This is very much available in social media, particularly in Facebook, where it's very much used here in the country. And if they would be having questions on their medicines, if they would like to report it on the level of pharmacists, then they can contact us here. As I've said earlier, this is also our part of our services and advocacy on all the medicines. If people would like to know more about it, if they have questions, if what they're using is really the genuine one or the real one or that of substandards, then they can ask the pharmacist on board in this pharmacy information service. And that's why we also gave here a title of Health Education for All, which is to be worked on by pharmacists and medication experts. Not only in Philippine Pharmacists Association, on the next one, please, we also are working with the government arm, that is the Food and Drug Administration, or the Philippine FDA. Of course, again, we're strengthening this one. We are waiting for more developments on this, but I do believe they are now going into these initiatives, just like Madam Leonie talked about earlier. And with this, they're also very much available in social media and with their website. This one, I got it from their Facebook account. They have it. So as it says on their tagline, safeguarding the public health. And you also see there the button on how the people, the Filipinos, can contact FDA and make their reports. And if they would like to look more on what are the substandard and falsified medicines that the FDA may have already discovered, because they have on their website as well as on their Facebook account that they also regularly would be uploading it there. But with that, we maintain this connection. I think that would be the initiatives that we're having right now as we are intensifying our that of how people may connect with us, most especially on the most comfortable and the most available and accessible way. That would be on social media and Facebook in most particular. And there is also another, on the next slide, please. Yes, aside from this, one more. Aside from us in the Philippine Pharmacists Association and the Philippine FDA, we also have the universities and the schools of pharmacy who are now setting up also this telepharmacies and doing their part on digital health. Though, as mentioned also earlier, that this is more on the private practice, we are hoping that we'll have this full support from the government also. Not only from the schools, we have that of the hospitals, the hospital pharmacies, community pharmacies, and we also have these online applications that the community can download. I have some few here that I can show you, please. Yes, this one is okay. Can we go a little bit slower in that one? This one is from the University of the Philippines College of Pharmacy. They have this telepharmacy service where online they have their Google Forms where people can ask their questions regarding and verify that of the medicines that they are taking. Aside from the University of the Philippines, we also have another. Yes, please. This is from another university who are also using it as part of the training for their PharmD students. This is called the telepharmacist from the Adamson University. A while ago, I was talking to the dean about it, and I was asking permission if I can share it to them, and she was very glad to share this one. Yes, we are doing it. That aside from people asking questions for counseling on their medicines, we also cater to have the questions if they are receiving, if they have seen, if they are using this substandard and falsified medicine. Another university that I'd like to show, this one is from the University of Santo Tomas. They call it the TelepharmD, where also they are having their alumni and as well as their PharmD students in training and answering questions regarding this as part of their services also to the community. And aside, I mentioned also a while ago, this is the Swipe RX. I think other neighboring countries would know this one also as one of the applications that we can download, that people can download mobile, where people can ask questions, post questions, and we have pharmacists who are ready to answer these questions, most especially when it comes to the medicines that are falsified and substandards. Aside from Swipe RX, I think I mentioned also this from the hospital. This is another hospital. I think this is the Paulo Garcia, yes, in Nueva Ecija. It's a medical research, memorial research and medical center. I guess I got that correct, in Nueva Ecija, that's in Luzon, Philippines, where in their hospital pharmacy section, they also put up this telepharmacy, assisting that of their patients as well as their clients with these questions. And I'd like to show this one to you. This is Moby Pharmacy, and we're very glad having Madame Leonie here as one of the community pharmacists, who is in fact the owner also of Moby Pharmacy. And I know that they have been dealing with this, especially in their immediate community, when people would be needing more information, and they're very much ready regarding in bringing digital health to the community. And if people would encounter, I'm sure they have all these programs as for more in improving the knowledge of their community to fight the substandard and falsified medicines. Moby Pharmacy. So that will be on the different initiatives. We have more of this with the chain drugstores, the independent ones, and even other universities and other stakeholders and enterprise. But with these ongoing initiatives, I would like to give mention of these drivers, as they would be very important on how we can mobilize this digital pharmacy or digital health interventions and approaches. just like anywhere in the world, but I think the Philippines is one of those topping this on the use of social media and internet, where it's really that dynamic and all sorts of walks of life, even on the streets and all. Everyone is connected and everyone's really staying long, handing that of their phones, where they can make a report immediately, and where they can participate much on digital health. There is also this very strong collaboration among the industry, among our pharma companies, that of the academe, and that of our practitioners. And we're glad to report that here in the country, we're having this set of policies, regulations, policymaking, the legislators who are very much interested to bring digital health, particularly on this cause. If you just click it, please. So there you go. I'm showing more of my countrymen who are very much into this use, and I know they would be into digital health later on once it becomes more available. Another, yes, this one is, I think it's a collaboration between one of the universities here from the University of Santo Tomas, with their collaboration with the leading, one of the chain drugstores here in the country, which they are also using for the training of their students. And at the same time, with the pharmacist of that chain drugstore, they would also be introducing this digital health, or they're into digital health. And as I've said earlier, we have that of the policies and regulations that are in place and would still be in place. I'm just flexing this one, although this was still our Philippine Pharmacy Act that we have signed in 2019. This is Republic Act 10918, where this has been passed with the leadership, of course, of everyone from PPHA, headed by Ma'am Leonie and the other leaders here, who came up with this. And even having, I just checked on it again a while ago, where telepharmacy has been defined, has been described, and stipulated on this law will be in support of this digital health. Next, please. But with all of these drivers, of course, on the next slide, I think this would be my last also, on the barriers and challenges. There would always be these barriers. I just also came from my class, the way I always say it, that if there would be challenges, I think we'd put it also as inspiration for all on what we can do, on how we would be mobilizing then our cause so as to fight substandard and falsified medicine. But we are aware this is happening, that there is misinformation, there is disinformation of the public due to the unfiltered social media and internet accessibility. Just a few days ago, there was this online sale, usually going on an 8/8 for an August 8, 9/9 for September 9, and I'm sure there would be another on 10/10 and then 11/11 and then 12/12 and so on. So they're going crazy already on the internet during this shopping sale. And one thing that I've seen is that of the medicines that are already being sold there. So we are hoping that we are going to do something with this, especially as we work with the FDA, Philippine FDA, so that if we can stop or we can regulate, of course, this online sales of this, and that we can improve more of giving rather the checking on the veracity of the information that is released to that of the public. And as also earlier mentioned, coming here in the country, that we are wanting for a more accessible, a comprehensive health program on digital health, as of course headed by our government institution. And we'll always be ready here in the Philippine Pharmacists Association and all the other pharmacies and all the groups here, and that if other private companies are having it, I guess it would be nice if we have like what we call a mother program that we can have us started by our government arm. Okay, just showing you here, please, on the, can you click it? There you go. So I know everyone's aware of this, that of the ongoing culture on looking on more news, on more fake news, and that we're going on a higher level of information, and that is to have digital health. And so we're going trampling on this fake news soon. and that I hope more of the professionals, more of our pharmacists are really going to educate the public about this one. And then another click, please. There you go. So this one, of course, even if I asked earlier of we are wanting to have this one more comprehensive program from Philippine FDA, they do have it available in websites, but this one is more on people on the community having a verification. They have a verification portal. You can verify there, looking if a certain company producing these products have their license to operate, or there is a certificate of product registration. I think that's how one now can check if these products that they have are substandard and falsified medicines. They do have hotlines also, but as I was saying, it would also be great if we can do it, which will be networked and linked to the different organizations, just like what we have in the Philippine Pharmacists Associations. So on to my last statement on my presentation. Next, please. This photo, I got it from one of the bigger companies that we have here in the country. And they also have this advocacy and geared towards the public, that of how the public may know if their medicine is fake. And as we would always say at the Philippine Pharmacists Association, you may click on that one. We are, of course, ready to help with all our partners. Okay, and that would include the Food and Drug Administration here in the Philippines, as we will all do our share in with that of digital health, so that we can be assured that we have safe, quality, effective medicines for all Filipinos, for all people, which would be available, accessible, and affordable. Thank you very much.
Yeah, excellent presentation, Mark. That's really fantastic, very comprehensive. I am, in view of the time, going to move very quickly on to Eric, and welcome back, Eric, to speak about the Taiwan experience of using digital health to fight substandard and falsified medicines. So, Eric, over to you, please.
Thank you, John, and all the panelists. Good afternoon. I'm going to present how we started to apply portable infrared spectroscopy to identify medicines in Taiwan. Next, please. And you can find the fake news in the internet elsewhere. And when you think of counterfeit goods, actually pharmaceuticals is a big margin. And in fact, by March 2020, Interpol's operation seized counterfeit pharmaceutical worth more than 40 million worldwide. That's a huge money. Next page. And also, WHO estimated in 2015 that 50% of drugs for sale over the internet were fake, and this is only increasing in low and middle income countries such as Africa and Asia. Next, please. And the latest on pharmaceutical counterfeiting, including COVID-19 related drugs, falsified Remdesivir and falsified COVID-19 vaccine, AstraZeneca, and falsified Pfizer-BNT COVID-19 vaccines. And it happens just last year. Next, please. And on the left-hand side picture is a normal pharmaceutical plant. And for the right-hand side is a machine that makes the fake drug. And this picture is from the Taiwan police force. Next page. So in Taiwan, we've got TIMPAC, Taiwan Medical Product Anti-Counterfeit Task Force. And we are a legal established nonprofit social organization. And we aim to combine relevant personnel engaged in the pharmaceutical industry, health authorities, pharmaceutical management, academic work to dedicate to prevention of counterfeit drugs. And we also enhance and so as to improve the level of drug quality in our country. Next, please. And we started from 2008 using the NIR to detect the counterfeit drug in community pharmacies around Taiwan. Next page. And this is the first generation NIR spectrometer we used before. Next page. And we also promote the NIR technique and applied the device in Taiwan. Next page. Unfortunately, there's some incidents of counterfeit in Taiwan and substandard drugs. You see Crestor and Vytorin we found in 2017, and Viagra 2011, and Cialis in 2020, and some substandard drugs such as Episolam and Approval just last year. Next page. In recent years, we started to work with Taiwan Innospectra Corporation. Next page. And they have already developed a detection platform, and especially in agriculture, pharmaceuticals, biologics, medicine, and other areas. Next page. And there's a different kind of electromagnetic spectrum, such as X-ray, UV, microwave, and infrared. Next page. But why we use near infrared? Because it's suitable for organics, and they are non-destructive and high precision, easy to use. Next page. And this NIR device can use to detect the falsified drug from the supply chain. Next page. And this is three major parts of the NIR device. The first one is portable precision device, and the second one is the reference drug database, and the last one is application to compare the test drug and the reference drugs. Next page. And there's a lot of such devices in the world. Next page. But documents stated that a high correlation when we're using the Innospectral NIR device, and the precision is as high as 99%. Next page. And the NIR device is a counterfeit filter. Next page. Because of advocating for portable and low cost, simple to use, rapid, and non-destructive tools. Next page. And we have already get technical transfer, evaluation, and pilot project to other countries. Next page. And previous study using 84 different drugs. They are white little pills, and the accuracy is showed a 99.8%. Next page. And there is two major paths for this device. One is classified, and the second one is qualified. And if the qualified can show the result match and not match to the comparator, to the originator or the branding drugs. Next page. And we have already completed collecting the originator and binding drug spectra, such as the lipid drugs. Next page. Hypertensive drugs. Next page. Diabetes drugs. Next page. Our ongoing project is to measure other drug forms, such as powder form. Next page. Because different forms has different absorbance level, so we develop a new technique, SNV, applied before HGD, and give a more precise result. Next page. So we can try to detect the powder form. The measurement of Merisan powder is a Japanese manufacturing branding drug. And the falsified drug can easily purchase from internet. So we got the standard reference curve as a next page. So we developed the curve, the standard curve for Merisan. So if the patients they buy from internet, and we can easily to distinguish which one is original and which one is fake. And next page. Okay? And so Last month, we just started to work with Taiwan Lotus Pharmaceutical Company, and we have an anti-counterfeit project to combat Cialis using the NIR device. And we hope that this can apply to other falsified drugs selling from the internet. So this is my report. Thank you very much.
Thank you very much, Eric. That was fascinating and great work that's being done there in, excuse me, in Taiwan. So I'd like to, at this stage, provide in this last few minutes a summary of what we've heard this evening on these couple of topics. Of course, we started listening to Christopher talk about the FIP Global Pharmacy Observatory. And then we got into the topic of digital health and supporting medication adherence. And I think the take-home messages for us was that there are a number of ways that we can apply digital health. It can be through the electronic patient database or providing access to drug information. Obviously, alarms for compliance were mentioned. And of course, the electronic prescription was a particular focus of a number of our speakers. We heard that it's the combination of the private and the public sector and some of the real issues we need to address. The integration of the systems and having a good regulatory environment to enable the application of digital health in this space. I must admit, I really thank Leonie for her 5 points that she provided as a wonderful summary. The need for leadership in this area, legislation to enable it to happen, good regulation to ensure competency and that we've got the right systems in place. We then moved on to hear about how digital health can assist with the issues of substandard and falsified medicines. And again, regulation featured highly here. We heard of reporting systems and the use of websites to provide people, the public, the capability to submit questions about their medicines and to determine whether they are falsified or substandard. And that can be operated by our national agencies, by hospitals, by pharmacies. But we also heard of the importance of social media. And social media was a bit of a two-edged, double-edged sword. It enabled the distribution of misinformation and disinformation, but it is also a way that a lot of our agencies and our organisations are distributing good messages, trying to address a public awareness and overcome the disinformation. Just final points there, and I taking this from Eric's presentation, a couple of steps that we need to think about. One is public promotion through those digital communication systems, and this goes hand in hand with a dedicated and specialised policing of this area using technical monitoring and testing, as well illustrated by Eric. So this is a very comprehensive picture I think you've received this evening. And just in closing, I'd like to thank the individuals. I'd like to thank our speakers, Christopher, Jared, Eric, Leonie, Andrew, and Mark. I'd like to thank all of them for the time they've put into their presentations. Yes, turn on your slides, let everybody see you, turn on your cameras. I'd like to thank them all, but I'd also like to thank some people behind the scenes. I'd like to thank Mila and Farah and Osgun, and of course I want to thank my co-host Walter. So I hope you found this presentation tonight, this webinar of use. There are a lot of people that you've heard from, and I'm sure they'd be happy to receive questions if you have any. So quickly on the screen there, you saw some other events that are coming, and there are a lot of questions that and issues that have been put in the chat. Hopefully we'll be able to get to you later on those points. But Thank you for the for attending, and I hope you've appreciated what you've heard tonight. Good evening.